So greetings to all of you and welcome to this a very important session. We are looking at panel number 2, what could we do or be doing better? And we have a very outstanding panel here, which I will just read their names so that we invest the time available to discussing the content of this session. So during this session, we hope to focus our discussion on a few items that will include knowledge and dissemination to this critical area, the mechanisms that must be addressed, some policy issues, and finally connecting to the relevance of One Health to outside traditional health sector. For example, communicating the impact on economies, local industries to an important stakeholders. So this panel, as I said, I'll just mention the names and affiliation to win time. John Balbos serves as the senior advisor and directs the NIEHS and WHO Collaborating Center for Environmental Health Science. He also leads the NIEHS efforts on climate change and human health. And has a combined background in clinical medicine with expertise in epidemiology, toxicology, and risk science. Christopher Braden, who is an MD, serves as the Deputy Director for the National Center for Emerging and Zoonotic Infectious Diseases at the US CDC. And Dr. Braden has served as on incident management team for multiple national and international responses. Then we have Carlos Das Neva, who is currently the director of the research and internationalization of the Norwegian Veterinary Institute in Oslo. He works mostly today with topics related to One Health and emerging threats, especially viral zoonosis, antimicrobial resistance, also with focus on low and medium income country. Unfortunately, Richard Oton, who is the editor-in-chief of The Lancet, has not been able to join this panel. And lastly, we have Christina Romanelli, who is the interagency liaison for the UN Biodiversity Convention under its joint work program on biodiversity health with the World Health Organization. She has over 17 years of experience as a sustainability professional working in policy evaluations and development. So that will do for the introductions. We will now turn over to the important questions in front of us to start. First of all, I will pose the first question and then go around the panel to just ask you to share your reflections. So my first question to you will be, taking into consideration the barriers identified from the earlier discussions, what are some key challenges that face the US and other areas that have lagged behind in integrating One Health into existing health systems? So if you could just reflect by comparing or contrasting this experience, and we'll start in the same order that the speakers were introduced, starting with John, please, if you can get us started. Then we'll go to Christopher and then Carlos. John.
Great, thank you so much, Dr. John. Let me just start by saying it's wonderful to be here as a physician who's worked on climate change for over 25 years. One Health is really not a new way of thinking or an afterthought, but it's really second nature. It's the primary paradigm for environmental health. And so I'm just delighted to be able to be part of this panel. In terms of addressing some of these challenges of integration and coordination, there are a number of challenges with stovepiping. Some of the stovepiping, to some extent even goes back to the Rio Summit of 1992, when we had two conventions signed, one on biodiversity, one on climate change. And even those worlds don't always interact as they could because we have two separate conventions. Within the federal government, we have a global health security agenda. We have a rollback malaria agenda. We have, major programs that exist to address problems. And we also have One Health programs. We have One Health programs in the CDC and in many of the agencies. The problem sometimes is that environmental health and One Health are not mainstreamed into those other major programs. And we see this even as we look at the executive orders, where we have many callings for reviews and looking at the global health security agenda. And sometimes there's a mention of the climate change impact, but it's not front and center. And so sometimes things move forward without the integration of the environmental perspective. The last thing I just want to say real quickly is I really want to emphasize some of the things that came up in the last session, that One Health is more than just pandemics and zoonotic crossover and looking at the health of animals, but we really have some gaps in looking not only under the ocean, as James was saying, but also at the microbial world, at the fungome, at the microbiome, at the One Health nature of plants, animals, ecosystems, and microbes, that I think will ultimately be one of the primary ways that climate and other environmental changes impact all health on the planet. I'll stop there. Thanks.
No, thanks, John. I really like that attempting to broaden the definition of One Health, or to provide clarity on it, because often it's limited to, it tends to have a perception of a limited focus there. So let's go to Christopher. And Christopher, good to see you again. It's been a while. So please take it and share your reflections.
Yeah, thank you, John, and it's good to see you too. Hello, everybody. I'm going to comment on two things that have been kind of central to a lot of the work that I've done over many years, especially having to do with early detection and response. It's a lot of the where I've worked either in foodborne diseases or in other types of responses. And that has to do with an ongoing challenge of surveillance. Even at the tactical level, beyond trying to really broaden what we collect as far as surveillance information in many different animal environment and human situations, just bringing that information together, even if you're talking about just laboratory data and epidemiologic data, oftentimes has been very difficult. And I think, in general, we work with rather antiquated systems and ideas about how data and surveillance can work, and we need to get beyond that. We need to start to use some of the modern system architectures for data and different types of data sources to really bring that together. And we're talking about some of the technical aspects of how data can interact in the cloud, those data pipelines coming into data lakes, and having some integration tools to where we can start to layer that data and see what's being collected in the animal health sector and the human health sector and the environmental sector. That's where I see, a struggle that we've had, and but there are new tools that we have. I think that we can really make some very good advances in that area. The second is also something that we worked on for a long time, and something that I was really involved with in a former job, and that is really bringing some of the agencies together to cooperate on investigations. We get signals. We need to determine whether those signals are real. If they are real, then the investigation really starts. But as John was saying, we work in silos in many times, and it's hard enough for us to be able to coordinate among ourselves within silos, and then we're being asked to cross silos and coordinate with many others. And that's a hard thing to do, but we really need to be able to do that more effectively. So in the domestic U.S. Circumstance, when we go to, for instance, in a foodborne outbreak, to do the investigations, whether it be in a plant or on a farm or something like that, we need to bring the human health experts along to be investigating along with the environmental health and the animal health experts in those investigations. And even more so than the three agencies that we typically work with, but going more like David Goldman was saying in the last panel, to look at wildlife, for instance, and how that interacts with the environment, that then interacts with the plants, that then interacts with plant health and human health. So I think there's much more that we need to do in order to enhance what we do in investigations in this cross-disciplinary way as we go forward. And that is at the international level, the national level, the state level, the local level. All of those things are important to be able to incorporate, as hard as it is. Thank you.
Thank you. Let's go to Carlos, please. Carlos, if you can share your...
Hello, John. Good afternoon, everyone, and thank you very much to the academies for the invitation. I guess it gets a little easier when we already heard to John and to Chris, but I'd like to focus perhaps on two issues here as well. I mean, you just mentioned what are we lagging behind, and I can't stop thinking, you know, we just made it to Mars, but if a Martian green guy had landed yesterday on our webinar and heard the amazing examples, he would have concluded that One Health is the way, and these guys know what they're doing. And probably there might be 4,000 of us that agree with this, but it might actually not be that true. And you asked, what are we lagging behind on health systems? And we could perhaps start already there. Perhaps what we are lagging behind is still just focusing on the health systems. We've lost many years trying to get vets and doctors to work together. It has its challenges. But perhaps what we're lagging behind is exactly incorporating financial systems, political systems, society systems, truly bringing this interconnectivity. And I sometimes challenge myself to think we manage quite, let's say, quite optimistically, we manage quite good with AMR. Countries have seen AMR as a global threat that needs connectivity, that needs transformation. And politicians, industry, pharma, private sector, public sector have come together from developed countries to those in still on the other side of the scale. We haven't been able to do this for a lot of other topics on One Health. I mean, pandemic is just the popular one right now. But what is missing there? Awareness, interaction, interest, funding, political will. I would say that I've read, for example, the One Health Nigerian National Plan or Rwanda's One Health National Plan. But I can tell you that in my country, here in Norway, we don't have a One Health National Plan. We have one for AMR, but not for One Health. And perhaps it's the same situation in many developed countries. My last point is, and Chris already touched it a little, perhaps I'm a little biased as I also preside into an international organization working on wildlife health. But, you know, I keep thinking of this Venn diagram, you know, our three circles must be the most used, abused, and sometimes misused Venn diagram in the last decades. And we've been focusing hard on the interfaces because that's where problems happen. But I keep telling sometimes to my students, if you don't take good care of the circles themselves, you're bound to have problems on the interface. And you know, when wildlife is so often now on the media, and I think we're only 4% of the biomass, but we seem to be responsible for everything bad that happens. I cannot wonder, have we been taking good care of that circle? We are doing a lot on the interface, but are we taking good care of the wildlife circle? I'm sure my ecologist colleagues will say, are we taking good care of that circle? Without taking care of these circles, those little overlaps, they will not be getting better. I'll stop here.
Thank you. And we'll remember the Venn diagram analogy. Let's go to Christina, please. Then we can take the, I'm looking at time here. We have 15 minutes to go. We'll go to Christina, listen to her, and then we can take additional questions from the audience. Christina, please, over to you.
Great. Thank you so much, John, for the opportunity to really join this convening that essentially, you know, is seeking to raise ambition for One Health through more integrated cross-sectoral action. And it's, it really is humbling to join this exceptional group of experts here. And just to give you some brief context, so you know where I'm coming from, I am an environmental scientist by training that has been working on sustainable development issues and global health policy development in practice within the WHO Department on Environment, Climate Change, and Health at WHO headquarters. So this is where I am now. But before that, I spent much of my career working on the joint work program, as you'd mentioned, with the Convention on Biological Diversity and WHO, where I had also contributed to the development of biodiversity inclusive One Health guidance. So really, I come to you with this broad, interdisciplinary, and cross-sectoral global view at this nexus. And just to echo some of the points that really have been made over the past couple of days and exemplified through, the various excellent examples that we've heard, we really need to get to a much more inclusive and coordinated framework for One Health. In my view, One Health isn't only an integrated approach that can make it possible to develop purposeful and coordinated responses to some of our greatest global health, environmental and socioeconomic and political challenges through the lens of systems thinking. It really is an opportunity for us all to work together across sectors and disciplines to tackle these challenges, these interrelated challenges, not only to strengthen monitoring, preparedness, and response to future health threats, but also, and perhaps most importantly, to build capacity for prevention by really acknowledging and getting to the root causes of ill health. While also tackling, as Carlos just mentioned, its social, political, environmental, and economic determinants, and to build social and ecological resilience, which isn't something that we talked so much about previously, with equity as a driving force in the context of global environmental change. So, as other panelists have already made eloquently clear, more than ever, the ongoing COVID-19 pandemic really brought to the forefront the interconnectedness between, the human, animal, and natural worlds. And it's made clear that we as an international community have largely failed in so many ways to adopt a systems approach to the health of our planet. And, while there's little time to do so, there's also, I think, a real hope and imperative to get things right moving forward. And, as others have acknowledged, One Health isn't new. And there are, of course, other approaches, related approaches, including eco-health, including planetary health, that seek to bring this interdisciplinary and cross-sectoral action together. But through the systemic lens of these approaches that I'm referring to, One Health provides a real opportunity for governments, the scientific community, the public and private sectors, local communities, to build back better and stronger by developing robust evidence-based opportunities moving forward. But we also have to consider the current context. And the current reality is that the decisions we're all making today as governments on how to build back better from the current COVID-19 pandemic can either lock in the damaging economic development patterns and practices that we've been engaging in for decades, or we can actually build toward a healthier, fairer, and greener society. So what do we need to do to get there? I would say that, as a testament to this common objective that we all have here today, WHO has done a number of things that have sought to tackle some of the missing links, and I'm just going to highlight two of them very briefly. So one of them is that in July, following a call to action by thousands of public health practitioners around the world, we launched a comprehensive manifesto for a healthy and green and just recovery that calls on the international community to prioritize a healthy recovery, also putting biodiversity and climate protection at the center to prepare and reduce our vulnerability to future health emergencies. So for those of you on the panel or maybe listening that are unfamiliar, the manifesto really contains 6 core prescriptions and over 80 targeted areas for action for a healthy and green recovery from the pandemic. That includes 6 essential pillars that I'm going to mention briefly to strengthen health system resilience. Investing in essential health services, promoting sustainable food systems as we also move toward a healthy energy transition, building healthy, livable cities in urban areas, ceasing to fund pollution to achieve net zero. And underlying those 5 prescriptions is a crucial starting point that we can and must first begin with, and that's the protection of nature as the source of all human health. And this has largely been missing from that One Health narrative. And that brings me to the second action that WHO has been taking leadership on and that the pandemic has really put to the forefront. So one of the, in the area of One Health, WHO has really been committed to One Health over several decades now. And one of the areas that it identified as lacking is certainly, first, adopting a broader perspective of One Health that not only looks at infectious diseases, but the full range of infectious and non-communicable diseases, and bringing to the table the ecological and environmental dimension, which has very much been lacking over the past over the past decades as One Health programs are developed and implemented, both at national scales and globally, for the most part. So I think for now, I'll leave it here because I think through these areas, there are numerous entry points that we can jointly tackle together and address in the course of this conversation. Thank you so much.
Thank you so much. I mean, that's a lot of food for thought there, building back better and stronger. And I think I would just like to ask a question that is not what I was asked to do, but I was also asked, given the privilege to ask my own question. I think, and for all of you who are very experienced in One Health, whether you could think of a best case scenario where One Health has worked. I mean, it could be a country example or a program example that One Health can work. I've myself struggled with that so much over the years. I think I'll leave that up to the panel, to you, John, Carlos, Christina, and Christopher, to take it in any order. Carlos, you did talk about Rwanda and other countries having their One Health programs. It would be very good to see or to learn from you, if you all, how a country that you're aware of has developed a One Health program and actually implemented that program.
I think perhaps John was going to say something.
No, go ahead, Carlos.
We can come up with many good ideas of good examples that are working. And we heard yesterday examples also from organized programs like Predict, and we have some others from the European Union that tackle specific issues. I think that the advantage of what we observe sometimes in some of these African countries, as an example, I could go to Southeast Asia, is perhaps as we're building a lot of these systems from scratch, it has perhaps because of that, I'm just saying, perhaps been a little easier to motivate people and to build together. While, for example, in some of our most developed countries, we have ongoing, and until perhaps right now, we thought very good, well-working systems that could tackle issues. So I would say that the good examples from implementing One Health come exactly from countries that have struggled with problems of disease, environmental struggle, economic problems that need more sustainable food systems. And we find many, many throughout the world. I think we are lacking actually a little behind in the more developed country, whether it's politics, whether it's economics, whether it's because we have parallel silo. Chris mentioned silos. Once you've lived in your silo for 10 years, it's 20 years, it's really hard to convince you that it works better to move to a joint silo. Perhaps in Rwanda and in some of these countries, we are getting a chance to build this from the beginning. And I think we should all perhaps learn from the good experiences. And I mean, we just heard Aaron out of Tanzania just on the hour before us. I think a lot of us in Europe and in North America have perhaps something to learn from going into these countries and seeing how it's working, because it is working.
You know, I think one way to think about what's been working and what's not been working is to look at early warning systems and surveillance systems for diseases and ask whether the sentinel species is animal or human. You know, there's many examples where we use sentinel animal species, which is fundamentally a One Health approach. You know, sentinel chickens, One Health approaches to infectious diseases. You know, those tend to be human agriculture systems and not wild systems. So, you know, I think where it's been working has been, you know, you can think of those examples where we have sentinel animals. Then we have sentinel animals being the humans, and that was coronavirus, Ebola, many of these outbreaks that probably are having their origins not in agricultural systems, but in wild systems. And, you know, I think that's a frontier. I think that, you know, that may become something more possible with interesting sensor and technological solutions that may be able to be deployed both remote and ground-based. So I'll stop there.
So this is Chris. I would say that, you know, where we've seen One Health work best is where there's a natural tie-in between animal environment and human health, and sometimes they've actually formed their own silos. So you talk about, for instance, rabies control. You have to get at vaccination of dogs before you can have rabies control, and so in those circumstances, you know, you start with the One Health approach, even though it wasn't called that to begin with, and to a certain extent that's been true with food safety. And to the extent that we also can see that vector-borne diseases is a One Health issue, why obviously in order to control vector-borne diseases, you have to address the vectors. And when you address the vectors, there's a huge ecological component to that. So certainly there are those examples where, you know, it is, you know, interdigitated, you know, from each side that you need to address those. But it's I think where we don't have quite the that interdigitation that we run into the challenges, and I think the one area that we've made progress in that regard, as Carlos had mentioned, is in antimicrobial resistance. We've worked on antimicrobial resistance in a number of sectors for quite a long time, but somehow 5 or 6 years ago, it seemed to really gel around some new funding that's come in, I think, in a number of different areas to address this, but really taking, you know, leadership, taking a role in making sure that there is a One Health approach to antimicrobial resistance, and recognizing, for instance, in the National Action Plan that was recently adopted in the United States, that we're missing the environmental component there, and recognizing, for instance, that you know, the pesticides that are being used are often antifungals that are important in human medicines, and you know, recognizing that aspergillus may be becoming more resistant to these important antifungals that are used agriculturally. You know, those are the types of things that bring it together, and we need to do that in many other you know, issues that we've identified as One Health issues.
Christina?
Thank you so much. The great thing about about speaking last is that the speakers before me have already summarized this so beautifully. And in fact, I was also going to raise the AMR example. I mean, those, you know, the presenters that have spoken yesterday throughout the course of the morning today have already provided very clear and tangible examples of what, you know, of areas in which One Health has worked. Worked well. But at the same time, I think it's really important to remember that now's not really the time to pat each other on the back and say, this is something that we've done phenomenally well. There are areas where there are absolutely significant gains that have been, you know, that have been made, excellent programs that have been designed. For the example of Predict is an excellent one in that regard, but there is still so much to do going forward, whether it be at the local, national, or global scale. And I just really want to reiterate that, you know, at the global level, in terms of One Health, we do have the tripartite alliance from, you know, between the World Health Organization, the FAO, and the World Organization for Animal Health. And one of the things that we've recognized is that despite our successes, there are areas in which we have failed and that significantly need to be strengthened. And that's why just, you know, less than 2 weeks ago, we have welcomed an expanded tripartite alliance to precisely to bring in the missing link, and that missing link being the one that other speakers have so eloquently pointed out before. The ecological and environmental dimensions of One Health have largely been ignored, while the human-animal interface has developed quite well over time. So,
John.
Yes.
I just want to take 10 seconds just to say one thing that I
Yes,
think I
yes, please do.
Another thing that I think is essential for the examples where it has worked is the community, the society involvement. We need to take these people on board, because it's easy to get the vet, the doctor, sometimes the politician, if you're lucky. But at the end, it's the local business guy that needs to change his business model. It's the big industry that needs to take environment aspects into their business plans. And it's the small children that need to learn before they start growing with the bad habits, how to change. So the programs that have worked have focused really well, I think, in taking along those who are supposed to be part of the solution. And that's something we should take home as a home message, I think, as well.
No, wonderful. I think with that, we will transition to the audience and kind of read some of the questions that are coming from the audience. I think the first one, I will just read it, is many of the One Health initiatives have been informal arrangements between committed individuals working in separate organizations or departments. How do we formalize these so that collaboration can survive changes in personnel, especially in government departments? So again, to that, I would just maybe add that how do we develop a matrix? Because it's one of the questions that have just come out there. So you can take those two together. So the panel, please, if you can minimize the screen. In any order, please, you can just feel free to take it and share your reflections.
Well, I can start, John, because this is something that I worked on quite hard for a number of years, just looking at in domestic U.S. Agencies to try and get beyond just the relationships you have one-on-one with others in order to make things work. You really do need to institutionalize the collaboration and integration. And that's not easy, but basically you need to get the leadership buy-in and then really start to develop the charters and the cooperative agreements and the memoranda to be able to make that a formal, interaction among the agencies, and it's not just one, but oftentimes you have to do this. I established something that had to do with data sharing among FDA, USDA, and CDC. One that had to do with how we conduct outbreak investigations. What are the SOPs that we use, and what are the roles of the different agencies, and what are the expectations in preparedness and outbreak response. And then still another one around how do we use molecular data when we with whole genome sequencing to really bring that on board for all the agencies involved. So there may be a number of ways that we do that. It's hard. You have to do it at every level, but it's something that if we all try and really accomplish that at the different levels. I know the tripartite, having WHO, OIE, FAO have worked in that regard. If the national governments are doing that, we have give the resources for the regional or state provincial governments to be able to start to work in those regards. Really trying to make sure that the different entities that you're working with, encourage that they have a One Health office that can coordinate among the different groups within agencies, because that's always a hard thing, even in and of itself. So that's the way that I've approached it and made some progress, but there's a lot more that needs to be done, as been well vocalized.
Thank you, Chris.
I was going to just chip in. I mean, Chris took, of course, the institutional collaboration, the political will. We do need, I think, political muscles and financial muscles to make this work. And I hope that the old argument that this is a lot of money for an uncertain deliverable, that argument has disappeared now. No matter how uncertain, it is cheaper than the costs of not doing. I hope that message we've taken in. Let's see once we get over the COVID wave. But I would add to what Chris was mentioning. So I agree, political and we need to organize ourselves domestically. We can't always expect WHO, FAO, and to do it. I would add also the education component. We need to be a little more integrated as well in how we educate. And I'm not talking about educating people just in schools. I'm talking educate, for example, business. We need to be coordinated, a joint strategy if we're going to succeed. And this is, again, an example where there is probably a lot of possibilities. It's a lot more than just connecting social, economical sciences to health science. It's a lot more than that, I think. But we could do a lot here at the local, national level. I know Christina will give us the international perspective, but I usually say FAO and WHO, and they have many other problems to think about when One Health is, again, a little more not an emergency. So we need all to chip in.
Actually, since you just referred to me, Carlos, it's a perfect opportunity for me to chime in. Just before you spoke, I was going to say that we very much believe in that there are a few components that are essential. Political will and coordinated action is absolutely instrumental. In engaging at all levels of governance, from local to national to regional to global, is essential. And of course, at the global level, we can provide that strategic vision, we can provide some oversight, etc. But as you say, at the local level is really where we have people who are at the front lines of national natural resource management, and we're very much aware of that, even at global scales. But also, speaking to local level, it's about engaging with local leaders, spiritual leaders, for example, traditional medicine practitioners, for example, because these are the people that have earned the trust of others within their community. And I would also say that essential to that is education but also developing a common narrative and a common vision, which is currently lacking, greatly lacking, whether it be across levels of governance, across sectors. So even within the use of these integrated approaches, we are creating new silos. So the development of a common narrative and vision will be essential to achieving that goal.
I would just add a few ingredients that people have touched on, but I just want to emphasize a few things. The 3 ingredients to add into the mix. We say political will. I would maybe frame it also as leadership, that the people who are running the programs or above the people running the programs need to articulate that this is important. If that doesn't happen, it's very hard to change practices. The second is we really have to think about the incentives. In a federal system, the big global health programs get a lot of budget, and there are disincentives to bringing in other parts of other agencies to work with you if you are worried about whether you will maintain control over all of that big budget. So we have to really give some thought as to the structuring of the finances, follow the money, and think about creating the right financial incentives to actually make these things work systematically. And then the third thing is the demonstration of added value, which gets to your point, Dr. John, and the evaluation side of it. People in public health and physicians and people in biomedicine are very data oriented. It's like, show me the data and we can start our conversation. They don't like to take things on faith. And I think, unrightly, that there's a lot of skepticism, at least in my years of practice of environmental health, a lot of skepticism that interventions that deal not with vaccines and drugs, but that deal with wildlife and ecosystems and wild land use and land management, that those kind of interventions actually change anything. There's a lot of skepticism. And so I think we have to, double down and we have to build in the metrics and evaluation to demonstrate that these, you asked, what are the successful examples, and those are good examples. We need more, and we need more that deal with these more complicated things, like looking at urban wildlife interfaces, looking at interventions related to environmental chemicals and toxins, looking at interventions related to the kind of things that are being done, genetic modification of mosquitoes, all of these different kinds of manipulations of the environment to protect health.
That was great. Sorry, John. Yeah. Is it possible to maybe just add a little bit to that? Because that was brilliant.
Yes, please.
To John's point. So, and just speaking to the point of how, public health is very much oriented, very much data oriented. And I wholeheartedly agree with that. But there is also a whole lot of data that we are not taking into account. And part of it is because we're not having those conversations across these disciplines. So we know, for instance, that prevention is infinitely less costly than response once a pandemic has already broken out. We know that we're losing species that we need to survive at over 1,000 times the natural rate. We know that we've transformed 3/4 of our land-based environments and 2/3 of our marine environments, particularly in areas not managed by local and indigenous communities. We know that more than 1/3 of the world's land surface and almost 3/4 of freshwater resources are now devoted to crop and livestock production. We know that over 60% of infectious diseases are of zoonotic origin. We know that land degradation has reduced the productivity of almost 1/4 of the global land surface. We know that urban areas have more than doubled over the past 3 decades. We also know that air pollution kills over 7 million people annually. We also know that the subsidies and economic perverse incentives have driven a completely dysfunctional global food system and energy system and driven climate change, which is set to cost over 250,000 lives every year. We know unhealthy diets are responsible for 11 million premature adult deaths every single year. And we know that approximately 1/4 of the global burden of disease is attributable to preventable environmental factors. Now, we know all these things, but have we really managed to tackle them and address them in a coordinated way? That's where One Health comes in. And that's where the opportunity lies, I think.
So we'll take, see, we have about 10 minutes to go. So I will try to take another question, which says, One Health programs often are highly localized in design and implementation. How can global policy preserve that targeted approach while still fostering critical international cooperation? I find that to be a very thoughtful question. I'll read it one more time. One Health programs often are highly localized in their design and implementation. How can global policy preserve that targeted approach while still fostering critical international cooperation? So maybe I'll just, I'll let Chris start, then we'll do Carlos, and then Christina, and then end with John. I'll just ask that if we need to take a third question, we just keep our comments as brief as possible.
Okay, thank you, John. So I think somebody said it before that I think if we talk about animal health, human health, ecological health, it's local. And we need to preserve the interventions that work at the local level. It's different in different localities. And so to the extent that we can develop those programs that work locally, we need to continue to do that. But that's not enough. It needs to be coordinated at the provincial, state, regional, national, and international levels too, because the policies really do matter. And I can see, from a perspective that I've had, that, for instance, we mentioned a few times here is the private sector. A number of the policies that can be state or national or international really do affect how the private sector conducts their business. And to the extent that we can really, it's not just regulation, although regulation is necessary, but it's also partnership. I have found that when you really sit down and talk to people in the private sector, they often have the same concerns, but they come at it at a different angle. And of course, then they have the bottom line that they have to maintain is financially and profitably. So, but oftentimes there's room for a lot of common ground. So local is where the rubber meets the road, for an old saying, but these other policies have a large influence, and we need to continue to develop them.
Carlos?
Yeah, I'll just to be short. I think as Chris was mentioning, the added value of being local relevant is key. But I think we can also perhaps agree that very often the scripts behind these approaches are very transversal. And it's not you can just copy paste from place A to place B, but if we were a little more interconnected, if we shared a little more data, if we shared a little more knowledge, perhaps these local shaped solutions would work a lot better, because it doesn't help to do a great bat surveillance for emergent diseases and 10 kilometers across the border, your neighbor is not doing it. And here, what could we do different? Here's where I think that perhaps one step up could be already to strengthen more of the regional solutions. I mean, John, you're sitting on CDC Africa. There's no better example than that. An institution that tries to centralize, at least it might be too far up to push everything that is coordination up to Geneva or to Paris. I think we can work a little more internationally at regional level, and making sure that individual programs make sense together. Share knowledge, share data, share experiences. might get us a lot there, because Christina was saying, we know this, we know that. I agree. We on this seminar and the 4,000 listening to us, we do know. But I think out there, no, they really don't know.
Wonderful. John, Christina, then we do John last.
Yes, exactly, Carlos. That's exactly right. So I think, yeah, there are a subset of us. When I say we know, I mean the scientific evidence clearly points to these things. And so we do have the scientific evidence to support these statements now. And I think this really comes back to, making those connections from local to national to regional to global. And these are messages that really unite us all. And it really brings us back to the need to create that common narrative and that shared vision. So there are no, cookie cutter solutions. Context matters. It always matters. That being said, there are always areas in which we can find shared opportunities and common goals. The Sustainable Development Goals, for instance, there's no cookie cutter way of implementing them at the local level, but we're all striving to achieve them. So I think working together across these spheres by ensuring policy alignment and coherence is absolutely essential.
Wonderful. John?
So I'm going to come to this from the perspective of my institution, the National Institute of Environmental Health Sciences, which has many years of building both citizen science and also the co-development of research agendas and community engaged research. And I think this provides a really good model for how to make these connections between the local and the global, and that research, whether it's in the United States or through work that we're doing, for example, under the Belmont Forum, which is in a global setting, that can support local groups in the collection of data, in the development of research agendas, and through sustained partnership in research. That is one very powerful way to connect the local up through the research funding institutions into the broader regional, federal, and international infrastructure. We have a collaborating center with WHO at NIEHS, and we have 10, 20 years of sustained partnerships between our core centers and community groups. And that has really led to some very powerful empowerment. And, I think it's through those, that's one way in which capacity building and an equity agenda can be incorporated into into the scientific and public health work.
Wonderful. I would not remotely try to summarize this very rich session, but I will let you all say, everybody give you 10 seconds to just use one word that you want the listeners to remember about this session and go around. Maybe, John, since you are still there, let's start with you. What is the one word that you want us to remember this session about? And then we'll go,
my goodness,
walk backward to Carlos.
I'm a terrible one-word person. But certainly, I'm going to come up with a new word which pulls together several concepts. I'm just going to say mainstreaming, which is a combination of integration and coordination.
Good. Carlos?
What one word, asking scientists to sum in one word is indeed hard. But I think I would go with commitment.
Commitment. I like that. I hear political will all the time, but political commitment is also very, very important.
That's why.
Yeah, Christina?
Again, wow, that's quite the challenge. One word, my goodness. If we had to go with one word, can I pretend Collaborative leadership is one word.
Sure, that is good enough. That is good. Collaborative leadership. And lastly, Chris, what would you like your listeners to? What do you like to leave them with?
Oh, the others took my words. But I think this integration idea, John, you said mainstreaming. That's it's integral to the definition of One Health. And it's integral to what we have to do at all levels and across sectors and across disciplines.
Wonderful. I think, you all summarize it. Thank you all for this very interesting, very productive. I've learned a lot personally. And I would like to thank you all for your very rich contribution. And here the organizers have asked us to take a 10 minutes break. So we'll break up at this point and then resume at 5 minutes past 12. So I guess that is Eastern Standard Time. And since we are in Addis Ababa, it's close to 8 p.m. So thank you all. And then let me return it back to the organizers and see you back in 10 minutes.